Henry Ford Macomb Hospital, Faith Community Nursing Network and Health Ministry, Documentation and Reporting System. You can use this service to document patients, interactions, and activities. You can also run detailed reports. This video demonstrates how to create a patient profile, how to document a one-on-one individual interaction, how to document a group activity, and how to run activity reports that capture all of this information quickly and easily. Please note, this video is meant as an introduction, and further training will be available as you begin to use this service. Begin by logging in at fcndocumentation.com. In this video, we will be using our training environment, which you will also have access to for your training needs. Here you have quick access to patient profiles, documentation forms, and reports. Let's start by creating a new patient profile. You will see a list of existing patients and a button for adding patients. Though only the fields marked with a red asterisk are required, the data in many of these fields will be used to populate fields on subsequent forms involving this patient. With that in mind, it is recommended to complete a patient's profile with as much detail as possible to save you time later and to promote data accuracy. Some data that may be used in subsequent forms include gender, height, age range, ethnicity choices, BMI, religion, member type, insurance type, and race. As you fill in the fields, notice that you can use this question mark button to open a list of diagnoses. If you like, you can copy and paste from that list to this form. In the Notes field, you can enter up to 5,000 characters of any other information that you deem important, such as patient family information, previous hospitalization, medical or surgical events, and health-related social information. This form is private, and its content can only be seen by you, and therefore, can serve nicely as your patient summary sheet. Continue filling out the form. After you've entered as much patient information as you can, save the new patient profile. Next, let's look at forms. Please note, you must create a profile for a given patient before you use forms to document interactions for that patient. You can document individual interactions and group activities. We will take a quick look at both, starting with an individual interaction. Begin by selecting a patient and clicking Submit. The form is meant to be flexible and accommodate different types of interactions. Depending on your need, you may not use the entire form. The top of the form is a general area for basic information and is recommended for all health ministers. The general area contains basic demographics and interaction information. Not all fields are required. Use the fields that suit your particular documentation needs. You can be as detailed as you need to be. After completing the general section, take note of the cost savings or cost avoidance section, and decide if it is relevant for this interaction. Please note, if a cost savings or cost avoidance item is entered, a brief explanation of your reasons why is required. You may find it useful to type a detailed note in this section. This is a good place to collect your thoughts regarding the interaction. In the medication area, you can build a list of medications that this patient is currently taking. Next up, notice the FCN Professional Process module and the DPP and Other Classes section. These sections are available for more specialized documentation. However, they may not apply to all of your interaction documentation. These will be explained in greater detail when you receive your in-person training. Finally, there is the Advanced Care Planning section. This is available as needed for more advanced care planning interactions. When you have completed the sections that apply to your interaction, click Submit. Please note, if you forget to complete any required fields, you will be prompted to complete them before submitting the form. Now let's take a look at a group activity form. Begin by adding a category. Enter as much detail as possible. To add a professional activity, you can click this button, which will open the section and enable you to complete the fields therein. When everything looks good, save the form. After you have documented some interactions and activities, you will be able to run a range of reports to help you analyze your records. We will take a quick look at a couple of these reports, beginning with the activity report. The activity report includes cumulative data from group activity forms and individual interaction forms. You can set your criteria and view a printable report. After taking a look, you can print the report from here, or return back to the report list. Next, let's take a look at the patient demographics report. The patient demographics report represents the demographics by patient number for those patients with interactions. You can set your criteria and view a printable report. These reports can help you better understand your data and ultimately help you to better serve your patients. Documentation and analysis are essential for the professional practice of nursing and health ministry. This system has been developed by faith community nurses, health ministers, and their administrators to help you meet your practice standards efficiently and effectively. If you have any questions, please follow up with the Henry Ford Macomb Hospital web specialist or the HFHS Faith Community Nursing Coordinator. And thank you for completing this video.